The holidays are almost here, and it's a time when many of us indulge in comfort foods like carbs and desserts. Well, that can be problematic if you're taking weight loss medication like Ozempic. So to talk about how to manage it, I'm here with Dr. Nita Bijoor, a family medicine physician at Oakview Medical Associates in Greenville. So thank you for joining us today.
Thank you for having me.
Let's first talk about some of the challenges that people might face this time of year, because I think, if you're on this medication, it kind of causes you to lose your appetite. But I know a lot of us, we want to enjoy the food on Thanksgiving dinner. So what challenges are people facing?
Yeah, I think so. Our hedonic drive, our feel-good kind of drive still tries to kick in, and so it's a battle between what the medication is doing for us. So I think some of the challenges are around all the sights and smells of the wonderful food and sugar and all that. So that's always difficult. Travel is a big challenge. If they're traveling, the meds have to be stored, the pens have to be stored in the refrigerator. So that's a big one. And just getting that level of activity, because it's cold weather, that's a little difficult. Although we have some, you can get creative and still stay active,
So can people skip a dose of medication of Ozempic if they want to?
So yeah, if you're traveling and by chance you don't want to take it with you, if it's within 5 days of the scheduled dose, then you can just take the dose whenever, if it's like 8 or 9 days after the previous dose, it's fine. But if it's over 5 days, then you might as well just skip and then wait for the next scheduled dose.
And how often are you supposed to take it?
Once a week.
Once a week, okay.
Yeah.
So maybe you could skip 1 week.
Yes, yes. But it all depends on the dose. If the dose is higher, then if you have a washout period, you can have more nausea when you get back on the next dose. So it's very important to talk to your physician about it, the one that's prescribing it, so you can stay healthy. Because nausea is a big side effect with the shot. So we've had patients that have skipped a dose or two, and then they get back and find the old, the medication which is at a higher dose, and then they call saying, "Doc, I feel like I'm nauseated and throwing up." So there's medication for that. But
what other tips do you have? I know you have a whole list of them.
Yeah. So for the holidays, I have my countdown, which is the 8 glasses of water a day. I also have tips like staying on schedule with your meds, just planning ahead for your meals, making sure you monitor for side effects, not drinking too much alcohol or avoiding alcohol if possible.
How can alcohol impact Ozempic?
So alcohol is all carbohydrate, it's all sugar. So obviously then your system is challenged to bring that down as well. So, it's just overloaded and overworked. So just to not drink or drink in moderation is important.
All right. And I know, as you said, you also have the countdown to Christmas where you have a countdown of, like 4 days, what is it, 4 weeks before do this, 3 weeks before do that?
Yeah, I have a bunch of tips because it's almost 7 to 8 weeks before Christmas and the New Year. So 8 glasses of water a day, 7 hours of sleep, 6 at least productive hours of the day working or getting educated. Then there's 5 servings of fruits and vegetables, and then there's 4 mindful activities. That could be prayer or thanking somebody, having gratitude, hugging someone. And then there's 3 servings of protein a day, because protein fills you up and that doesn't make you binge eat. And then there's less than 2 hours of screen time a day, and then 1 hour of physical activity at least.
All right. Yeah, that could be the song, countdown to Christmas. So, all right. Thank you so much, Dr. Bijoor, for joining us today.
Thank you.